Hi, everyone, and welcome to ED Connections, where we are live and connected. I'm Ashley Pennington, and I am our Senior Regional Director of Clinical Partnerships for the Eating Disorder Network. And joining me today is Kara Pate, Regional Director of Clinical Partnerships, and Meggan Desmond, Clinical Director for Toledo Center for Eating Disorders, part of our Eating Disorder Network. Our Eating Disorder Network is comprised of Selah House, Magnolia Creek, and Toledo Center for Eating Disorders. We meet clients exactly where they are in their journey to recovery. We provide the necessary therapeutic techniques to empower sustainable freedom. Our expert clinical teams help clients understand that recovery is possible by utilizing individualized treatment plans comprised of a combination of evidence-based treatment modalities. Our goal? To make each client feel safe and close to home by conducting all levels of care in comfortable and home-like settings designed to offer a clear step-down process so that clients feel continually supported in their recovery journey. Again, it is my honor to introduce to you today Kara Pate, Regional Director of Clinical Partnerships, and Meggan Desmond, Clinical Director for Toledo Center for Eating Disorders. Kara, walk us through the Toledo Center difference.
Absolutely. Thank you so much, Ashley. So like Ashley said, I'm Kara Pate. I'm the Regional Director of Clinical Partnerships for Toledo Center for Eating Disorders. We are a residential treatment center for adolescents and adults who are with a primary eating disorder diagnosis. We treat all genders at our program, and we use evidence-based treatment to help our clients heal. We're a network with most major insurance providers, and we have a very comprehensive team comprised of therapists, dietitians, nursing staff, support staff. We have psychiatrists and medical doctor on our team as well. We are located in a beautiful little town, Sylvania, Ohio, just right across the border from Michigan. But it's a really lovely setting where our clients can come and heal. Meggan Desmond is our clinical director. She's a licensed social worker. She's been part of our team for the past 19 years. She started as support staff, and she has just continually been promoted and worked her way to the top, where she's now our clinical director, our leader, and incorporates so much of the programming that we do just to help our clients heal. So Meggan, thank you so much for joining us today. Could you just share a little bit about yourself and the dedicated team that we have at Toledo Center?
Absolutely. Thank you for the opportunity just to be able to share about Toledo Center. But yeah, as Kara had mentioned, I've been with the facility for 19 years, and I'd been drawn to the eating disorder population earlier than that. I had a friend in school who struggled, and then all throughout college, I was just really drawn to, research that focused on eating disorders and really trying to better understand and educate myself in the field. And then it was kind of like fate, I guess, that I got the job here. And then throughout the years, kind of encouraged to return to school for advanced degrees, ultimately wanting to be a therapist. So that's kind of how I got here. But yeah, our team, I think we have an amazing team here, and I'm very fortunate to lead such people. Not only myself, but we have years of experience on staff. Our primary therapist, Sam, she's been here over a decade. Our HR people have been here for close to 2 decades. So we have, you kind of mentioned, Kara, we have the multidisciplinary team. So we're really robust with, and fortunate that we have doctors, psychiatrists, nursing, therapists. We have specialized therapists in terms of we have a recreational therapist. We've added that to the program recently. So really excited about that. And then really, I think just, through the years, we learn by experience, right? We learn what works and what doesn't work. And I really think that experience has helped me be able to shape the program into something that's going to benefit patients and their families, and so that they can get, optimal opportunity for recovery and ultimately freedom, right? Because that's what we're working towards. So, yeah, it's a little bit.
That's so great. Yeah. And it's something you can feel when you're on the campus down there, is just the team and how they've been together, they've worked together. And just, it's almost like they've gelled in their treatment. And just, Toledo Center is somewhere where I would feel comfortable sending, anybody in my family. And that's it. It's just the heart and compassion and clinical excellence that all of our therapists and team just really possess, which is amazing.
I really appreciate you saying that. And I think that's probably the highest form of a compliment. In the back of my head, I've always thought that, like, I wanted to be proud of the program in terms of, that I would feel comfortable and safe, like, referring a loved one or a family member. The experience that I would want them to have is the experience that I'm trying to create here. So I appreciate that compliment too.
Yeah, you guys have done it, and you've done it well.
Thank you.
Yeah, absolutely. So, and we're so grateful that Toledo Center, we accept all genders with our adolescents and our adults. But could you walk us through maybe how the treatment could look similar or different, let's say for a male with an eating disorder?
Yeah. So we're really proud of the fact that we do treat all genders. 10 million boys and men will have an eating disorder at some point in their life. And even that number is probably misrepresented because so many boys and men go misdiagnosed or untreated. So at Toledo Center, we're committed to, emphasizing the support and help that those folks need. In terms of treatment for males, I think treating the eating disorder looks somewhat similar, right? So we're going to normalize the relationship with food. We're going to address thoughts and behaviors of the eating disorder, build healthy coping skills, building insights to core issues. But maybe how we do that, I think, looks a bit different for males. So we're sensitive to the fact that they're going to have a bit of a different experience here. Also trying to explain and educate to them and their family members, about eating disorders, because this oftentimes families are confused by this too. Culturally, I think boys are brought up to suppress their emotions, be tough. And, the problem with that is if people have difficulty with expressing their emotions, oftentimes it's going to turn into a negative coping skill, right? So I think with boys in general, we do a lot more, intensive education and help on building an emotional vocabulary, expressing needs, and then working with the family in addition to that. And I think body image probably looks a bit differently for our males too.
Okay.
Not only would there be a focus on, thinness or leanness, but most of the time with our male patients, we'll hear a lot about musculature and kind of the ideal physique for a male might look different than the ideal physique for a female, but they're still trying to attain often what's unattainable or extremely unhealthy. So kind of understanding those pieces and like I said earlier too, also educating them on their disorder, educating their family, because even if you think about it, even the resources and books and workbooks and things like that are out there are typically talking to a female audience. So the things that they're using don't really speak their language. So we try to be really sensitive to that fact and create a different type of experience for them here.
Oh, that's so great. Can you tell us a little bit about what clients and families can expect regarding programming at Toledo Center?
Sure. Yeah.
Maybe just with our nutritional model as well and
sure.
clinical approach.
Yeah. So we, I think, our focus here is to restore people both, physically and emotionally. So with the food piece of the restoration of recovery, what we're really trying to focus on and move towards is kind of an intuitive eating approach. So what that would mean is, not using measuring cups or food scales or things of that nature, but really trying to have the patients practice repeated exposure to portioning the appropriate amounts. So that's typically guided by a staff member. We do a lot of family style eating. So trying to create the most kind of natural experience we can with food, similar to what they will be experiencing once they go home. A lot of the food items that we're eating will be things that they can cook when they go home. I think that also builds confidence, not only in the patient, but for the families too. I'm always sort of taken aback when I see the surprise on, parents or family members where there's, they'll say, wow, they ate that, or they're eating this. And, I kind of want to just say to them, yeah, that's what we do here. That's what we're everything we do. So yeah, we're kind of moving in that direction, and we follow the all foods fit model. So everything's okay to eat in moderation. We do some exposure therapies with different types of foods that might elicit a more anxious response for people, so that we can help normalize that relationship with food. And then our dietitians are working carefully on the, in the background to make sure everyone has an appropriate amount for their individual treatment plan, and sort of carefully navigating that. In terms of the program itself, we've because eating disorders are so, there's such a balance between the physical restoration and the emotional restoration, that we've balanced the day with therapy, eat a meal, therapy, eat a meal, therapy, meal. So it's kind of back and forth that allows the patient to kind of process their feelings throughout the day, not only about food, but some of the core issues and group topics that we might have. So we do a lot of group-based therapies. Each individual would have an individual therapist that they work with. A family therapist works with the families to really kind of provide education, empower families, and also, I think, help build their confidence for when their loved one comes home, knowing that there's going to be responsibilities on their part that seem, very scary in the beginning, but we hope to give them the confidence by the time that they discharge.
Okay.
So yeah.
Yeah, it sounds like there's a lot of support around the mealtime and with the therapists and everybody involved in that.
Yeah.
So that's incredible. If there's a family, go ahead.
Oh, sorry. Go ahead. So I think another thing that makes us a bit unique is that we're so small here that people really get that individualized care. And, even the therapists here, we're sort of ever present throughout the day. So even if I'm not, I may see patients individually, I may be running a group, but I'm also, might pop into the kitchen during lunch and sit with a patient through their meal, in addition to the staff that would be sort of guiding them through their meals. So I think given that we're small, it gives us an opportunity maybe that most larger places wouldn't be able to provide.
Right. Absolutely. So if there is a family or a client, a potential client who's watching this interview right now and contemplating, do I need a higher level of care? What level of care do I need? What would you say to them, or how would you differentiate Toledo Center from some of the other programs out there?
Yeah, well, I think the first step is, talking to an experienced eating disorder specialist to understand what the level of care need looks like and what that is. So provide different levels of care even here, but I think getting some guidance on that is important. And then I think too, for me and working with families, just knowing that we sort of have an understanding of where they're at in this process, both the patient and the family. I often kind of have this experience when I'm first working with a family. Usually it's on the first day, even when we meet, we're talking about, treatment expectations and treatment goals. And I'll hear a phrase and some derision of kind of, I've just lost them. And I want my kid back, or I want my wife back, back. And that always sticks out to me because it's, I guess, when people first come here, they're just kind of a shell of themselves because the eating disorder has taken over so much. And there is a desperation, a sense of hopelessness, and anxiety and fear in those first days and those first meetings. And at the end, when I wrap treatment up, at the end of the process and at discharge, I always wait to hear it, that I'll hear, the loved one will say, I've got him back. Got my kid back, and when they see their personality and things like that come back. And that's when I know, like, we've done it. We've done our work here to get the family and the patient ready for that next level of treatment in terms of following the recovery with an outpatient support team. So really we're focusing here on building the skills necessary to kind of sustain recovery. outside of treatment with different providers and continuing their journey to finding freedom ultimately.
It's so great. I think that's been one of the biggest blessings for me being part of this team is being down there, seeing, the lights come on, for lack of a better term, in our clients, and almost like this waking up to what's possible for their lives. And so, thank you so much for your time today, Meggan. And, just to reiterate, it is truly an honor and a blessing to be part of this team. And I recommend Toledo Center for any family that's seeking treatment for a loved one. So thank you. And Ashley, we'll give it back to you.
Absolutely. Well, thank you so much, Kara and Meggan. We can certainly hear it in your hearts and in your passion that Toledo Center is truly a special place to walk into freedom. Thank you both so much for your guidance and showing us the Toledo Center difference. For more information about Toledo Center or our eating disorder network of services, or if you or someone you know is suffering from an eating disorder, look no further. We are here and we are ready to help. You could visit our website at www.toledocenter.com, which also has information linked to our eating disorder network. You can contact our admissions team that runs 24 hours a day, 7 days a week at 765-641-0022 with one call and many solutions. You can also private message us on social media through our Facebook, Instagram, Pinterest.